Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the Central Council of Health. It promotes coordinated and concerted action between center and the state in implementation of all the programs and measures pertaining to the health of the nation. The Union Health Minister is the chairman and the state health minister are members. Next is the functions to consider and recommended broad outline of policy in the remedial and preventive care, event, hygiene, nutrition, HE, and research to make the recommendation to the central government on grant in aid and review utilization periodically. Next is to establish the organization for maintaining cooperative. There are the cooperation between central and state health administration to make the proposals for legislation in medical and public health matters for the development of the country. At the state level, in all the state, the management sector comprises the state Ministry of Health and Directorate of Health. It's responsible of the state in provision of medical care, preventive health services, and the pilgrimage within the state. For a long time, two departments, medical and public health, were functioning in the state. Of the heads of these departments were known as the Surgeon General and Inspector General of Civil Hospital and Director of Public Health respectively. The Public Health Engineering Organization in most states is part of the Public Works Department of state government. It has been recommended by experts in the public health that the Public Health Engineering Organization in every state should be part of the state health department and that the chief engineer of public health should have the status of an additional director of health services. Next is the state health administration. At the present, there are the 28 states, each state having its own health administration. Organization pattern. State Ministry of Health and Family Welfare, Deputy Minister of Health and Family Welfare, Health Secretary, Deputy Secretaries and Administrative Staff. The State Director of Health, Director of Medical Education, the Dean of the Medical College, State Nursing Supplement. There are the State Nursing Superintendent, Director of Health Services, Additional Director of Health Services, Deputy Director of Health Services, Hospital, Nursing Superintendent, Ward in Charge, and Nursing Staff, Education, Nursing Officer, Senior Tutor, Junior Tutor, and these are the chart of the State Director of Health. Next is the function of the State Health Director. Studies in depth the health problem and need in the state and plan the scheme to solve them. Second is providing the curative and preventive services. And third is the provision of control of milk and food sanitization, prevention of any outbreak of the communicable disease, promotion of health education, promotion of health programs such as school health, family planning, occupational health, supervision of PHC, establishing the training courses for health personnel, coordination of all health services with other minister of state such as Minister of Education, Central Health Minister and the voluntary agency. So these in today's class I discuss about the Central Council of Health, their function and at the state level and also about their function of the State Health Director. Thank you for watching.